Good afternoon. Today is Tuesday, January 12th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me once again is Diane Oldenburg, Senior Public Health Educator for the County Health Department. Since our update last week, we've had more than 500 new cases of COVID-19 in our county. Sadly, we've lost 10 more members of our community to COVID in the past week. On behalf of the County Legislature, I extend our sympathies to the families and loved ones of all those who we have lost to COVID. We must all do our part to protect our families and communities. Protective measures such as face masking and avoiding non-essential gatherings must become our personal priorities if we hope to stem the spread of new infections. This is paramount to preventing future deaths. Those who test positive should isolate themselves at home until they are contacted by the health department. Last week, the governor announced several more groups who are now eligible for the COVID-19 vaccine. In addition to the frontline healthcare workers in the Phase 1A group who haven't been vaccinated yet, those now eligible to receive the vaccine include individuals 65 and older, those who are immunocompromised, first responders, public safety officers, teachers and other school staff, in-person college instructors, child care workers, public-facing grocery store workers, transit workers, and individuals living and working in homeless shelters. We are hearing conflicting information, and there's a lot of confusion about how people can make their appointments. Here are the facts. No one will receive a vaccine without an appointment. There are no walk-in appointments. People can go through the state website at amieligible.covid19vaccine.health.newyork.gov to learn if they are eligible, or they can call the New York State Vaccination Hotline at 1-833-NYS-4-VAX, which is 1-833-697-4829. If you are eligible, you will be directed to a list of places to make an appointment for the vaccine. We realize that yesterday servers were overloaded with requests and some of the links on the New York State site were not functioning. We ask people to keep trying and to be patient. This is true for clinics in Oswego County and other areas of the state. Some places, such as New York State Fairgrounds, are booking appointments several days in advance. Vaccine supply is our main challenge. There are very limited allotments of COVID vaccine coming from the state to Oswego County. We have people clamoring for the vaccine, and our county health department is ready. All doses that we have received have been administered. Oswego County has mass vaccination plans in place that we practice every year. All we need is for the state to send us more vaccine on a regular schedule so we can plan and publicize vaccination clinics. In total, there are now 5.3 million New York State residents who are eligible to receive the vaccine. As the governor said last week, if the state doesn't start receiving more vaccines from the federal government, it will take 14 weeks for people in the first two priority groups to be vaccinated. Our county health department and our healthcare partners are doing their best to deploy the vaccine within the guidance that New York State gives us. We must strictly follow the state prioritized schedules to administer the vaccine. We ask our residents to please be patient and bear with us. The amount of vaccine we receive and the links on the state website are not controlled locally. Our community-wide pandemic response team has a capability of vaccinating several thousand residents a week, but we only currently receive a few hundred doses in that same time frame. We have no choice but to work with what we have and under the rules that the state has established. Again, patience and continued proper protective measures will help us persevere. After you receive the first dose of the vaccine, you will need to wait 3 to 4 weeks, depending on the brand of the vaccine, and then get the second dose. It really is until after you receive the second dose that you start to become more fully protected, so people should continue to follow all the protocols, including wearing a face mask, avoiding unnecessary gatherings of all sizes, and wash hands frequently to prevent the spread of the virus. We will continue to keep you informed as more vaccine becomes available within the New York State guidelines. And now Diane will share more information from the Health Department about the vaccine and the spread of COVID in Oswego County.
Thank you, Chairman Weatherup. The data from the New York State Department of Health shows that COVID-19 infection rates remain high in Oswego County. As of yesterday, the 7-day positivity rate remains at 9.4%. A few days ago, it was 10.5%. Our county health department is monitoring more than 1,100 county residents with active COVID virus, and more than 1,700 residents are in mandatory isolation or quarantine. As of this afternoon, we have 116,014 total tests have been conducted on Oswego County residents. We have 4,660 positive test results. We have 1,174 active positive cases. We've had 3,429 patients released from isolation. We have 57 deaths reported by New York State related to COVID-19. We've received 109,760 negative test results, and we currently have 1,708 residents in mandatory isolation or quarantine. The Health Department is now accepting applications from active and retired medical professionals who want to volunteer to help in our COVID-19 response activities. People with a medical background can help fill a vital need at vaccination clinics. We are encouraging physicians, nurses, dentists, pharmacists, medical assistants, and other professionals to apply through an application on our website. We encourage those who want to help with the community vaccine distribution to visit the Health Department's COVID-19 page and provide information about their medical license, availability, area of interest, and related information. The application form is posted at health.oswegocounty.com. We thank residents for their patience as vaccine distribution gets underway. We are fully ready to administer vaccine as we receive it. Please remember that there are far more people eligible to be vaccinated than there is vaccine currently available. The Oswego County Health Department is committed to getting vaccine to eligible residents as quickly as possible. I also want to remind you that it's not too late to get your flu shot if you haven't already. This year, it's more important than ever, not only to reduce your risk of flu, but also to reduce the burden on our healthcare providers that flu and COVID cause. You can schedule an appointment at the Health Department's flu clinic in Oswego by calling 315-349-3547. The Health Department's COVID-19 hotline is open Monday through Friday from 8:30 a.m. to 5 p.m. and Saturday and Sundays from 9 a.m. to 1 p.m. The number to call is 315-349-3330. Thanks.
Thank you, Diane. People should expect that they can be exposed to COVID anytime they are out in public. We've had several new places of public exposure over this past week, including the Oswego County Board of Elections. The Board of Elections office will remain closed until January 21st. Given the nature of the work of the Board of Elections and to ensure network security of voter records, limited work can be conducted remotely during this time. The building will be thoroughly cleaned and sanitized before it reopens. All known contacts of COVID-19 positive patients are being notified through the Health Department's contact tracing investigations. Locations of potential public exposure are posted on the Health Department's COVID-19 page at oswegocounty.com. For the safety of yourself and your loved ones, for your neighbors and community, for healthcare and frontline workers everywhere, please continue to use the tools that have been used to stop the spread of COVID-19. Wear a mask, socially distance, avoid gatherings, and wash your hands often. Thank you for your patience as we work through the challenges of the current limited supply of vaccine. This too shall pass, and there will be enough for everyone. And thank you for doing your part to prevent the spread of the COVID-19 virus.